Hello guys, my name is Asia Edie, and this is my project, my Reteach project for CDE 450. This project is going to be on childhood onset schizophrenia, as you do see on the screen here. This topic was given to us, was given on the list, and I chose this topic because out of all the ones that were on the list, this was the one that I had the least amount of knowledge on, and I really wanted to give myself the chance to learn something new and really broaden my horizon as a senior here at ASU. So nevertheless, here's my project on childhood onset schizophrenia. So what is childhood onset schizophrenia? So this is a rare mental health condition that affects children typically under the age of 13. It involves severe disruptions in thinking, emotions, and behavior. Children with this condition may experience hallucinations, which include seeing or hearing things that aren't there, delusions, which include having strong beliefs that they are not based in reality, disorganized thinking, which is difficulty organizing thoughts or speaking clearly, emotional changes, which can include seeming very withdrawn or behaving in strange or unusual ways, and this condition can make it hard for children to function at school and be with friends. So children with this condition may find it difficult to make friends in school, nurture relationships that are lasting throughout life. Those things that seem easy for us can be very hard for children with this condition. This can also make, the rest of their lives extremely difficult when it comes to, starting a family and things of that sort. So here is a snippet here. So did you know research has shown that individuals with early onset schizophrenia tend to struggle more with terms of work, relationships, and symptoms rather than those with the later onset. So what this is saying is that when the schizophrenia onsets in childhood, these individuals are known to struggle more in the realms that are important, right? So in the realms of work, in the realms of relationships, and things of that sort. Here's some signs of childhood onset schizophrenia. So if you're concerned that your child or a child that you know might be developing childhood onset schizophrenia, here's some warning signs to watch out for. Number 1, unusual thoughts or beliefs. Number 2, hallucinations. Number 3, changes in behavior. Number 4, difficulty with thinking or concentration. Number 5, emotional changes. Number 6, socially withdrawn. Number 7, strange speech patterns. And number 8, decline in academic performance. Now, some of these we're seeing again from the previous slide. This picture here is showing a therapist kind of going over her patient that does have childhood onset schizophrenia, going over with him, just talking through this with him. So there is an autism overlap with this disease as well that can be seen. Children that have these diseases have things in common, but they are different. Both of these can make it extremely hard for children to connect with others, which we touched on earlier. Kids with autism might have trouble understanding social cues and signals, while those with schizophrenia stay away from these interactions as a whole because they are confused or fearful about the interaction. Communication is difficult for both, as we can see, and they both struggle to understand body language. And children with schizophrenia, they are more known to speak in jumbled ways or say unusual things. They may be sensitive to things like sounds or lights or textures. However, autism is a condition that starts early in life, while childhood schizophrenia comes on later and includes more serious problems like seeing or hearing things that aren't there. So when should you go to the doctor, right? At what point should you start getting this looked at if you suspect your child may have childhood onset schizophrenia? It's important to get help quickly, right? This usually begins to set in around the age of 13. You want to look for signs like we went over before, all of those, signs that we literally went over. You can talk to a doctor or a mental health expert right away for best results, and it's beneficial to not wait until the child gets old and to take action right away. So suicidal thoughts and behaviors and kind of how they connect with schizophrenia. People with schizophrenia often think about or try to harm themselves. If your child is thinking about suicide or has tried to hurt themselves, Please keep someone with them. Call 911 or local emergency number right away. If it's safe, take your child to the nearest hospital emergency room right away. And here are my references for the project. Thank you so much for your time, and thanks so much for listening.